you like sex? Of course you do. But we all know that a romp in the hay can be really hazardous to your health. That's why it's always a good idea to get tested regularly for sexually transmitted diseases. But sometimes that can be an awkward and expensive ordeal. Here's Fawn Oath and her guest to tell you what you need to know about STD testing.
Tonight we've been looking at the future of HIV. But is HIV and AIDS the only sexually transmitted disease to be concerned with? According to the Center for Disease Control, an estimated 2.8 million people are infected with chlamydia every year in the United States. Additionally, they estimate 700,000 new cases of gonorrhea, along with over 32,000 reported cases of syphilis annually. Most astoundingly, the CDC estimates that 45 million Americans are currently infected with genital herpes. What is being done in Colorado to help fight this scourge? To explore this issue, we have with us Bob Noguera, who chairs the board of directors for the Colorado AIDS Project and has been volunteering for them since the early 90s. We also have the pleasure of talking with Eve Hoygaard, a nurse practitioner for Jefferson County Department of Health and Environment in their family planning and STD clinic. She's also helped pioneer health programs for lesbians in the Denver area. Thank you both for joining us. Nice to be here.
Thank you.
And because we're talking about infection, I have an infection of my own, a laryngitis, so I hope you're be nice to me to our talk today. Well, I wanted to talk about some of those figures that we've just heard, and how just astounding it is that not only are STDs still a part of our world, but they're growing. What do you think is contributing to this resurgence of STDs?
Well, there's a lot of reasons, which I'm sure we each have our own ideas on, but one of the ones is just that a very basic one is that there are more people in this country who are in the age groups to be sexually active.
That would
that right there. You have the same percentage of, a million or of 2 million, you've got twice as many people.
That's a very simple explanation,
that's
sure.
A pretty basic, simple one.
Sure.
That's a starter.
Bob?
In my view, I think that the availability of medication in our country, I think also can develop a little bit of a lighter attitude towards risky behavior, and that might be causing some of those increased numbers as well.
Do you think it's seen as less of a concern because it's not seen as quite the fatal disease that it was before HIV specifically?
Well, I think in my view, HIV is often viewed by those that might not be in the know as something that's a chronic health condition that's managed and can be managed, simply with medication, and that's really just part of the story with HIV. But I do think that the drug cocktails that came out many years ago really did create this false sense of security and safety with a lot of people.
One other thing is, we look at the number of cases. There may be one person with 3 diagnosed different conditions, since most people who have one STD are more likely then to have a second STD as well, to be exposed to it. Sure. So just because there's, we just have to remember that doesn't mean that adding all of those people together to get how many people have an STD, because a lot of people have the same one, or they may have it something 2 or 3 times during the year. You may see somebody with chlamydia 2 or 3 times during the year.
And people often don't realize that once you've got an STD, you are at risk for getting other STDs as well as HIV. Which kind of brings us to the idea, and we may come back to the social factors later, but the risk factors. Often people will say, well, I'm not really at risk for chlamydia, or I'm not at risk for HIV. What would you say to those people?
Well, many people are at risk that don't realize it, because obviously the only way, abstinence is the only 100% way to not be at risk at all. People who are in a completely monogamous relationship, 2 people that are, any 2 people, if they both were tested and clean to start out with, they probably are at very low risk of getting something, because you don't get it walking down the street. But the more exposure chances you have, the higher your incidence of getting any STD.
And if daytime television has taught me anything, it's that you can't trust your partner. So even if you're in a monogamous relationship, that may not be the answer to being STD-free.
Well, and I also think that the risk factors can be altered by behaviors as opposed to sexual identity.
Very true.
So someone who might not identify as gay, but might be having sex with, a man having sex with a man, is obviously putting himself at risk, and then putting his partner at risk too.
So often seen just a label says, if I label myself as gay, as a gay male, then I'm at risk. But if I don't keep that label, if everything is on the down low, then I don't have to be concerned. I'm not at risk.
Exactly. And you mentioned the down low, and within our country right now, African American women see the highest increase in incident of HIV positive diagnosis right now.
Right. And correct me if I'm wrong, Eve, women are at the highest risk in general for STDs. Is that not correct?
They are at high risk, I think. And many I think, and I can't say exclusively this, but I think it's within many areas, the men are more likely to have multiple partners than women. And just in traditional, especially in more traditional cultures, most of the women have limited partners, except the ones they're exposed to because their partner had other partners.
And if I'm not the one having promiscuous sex, and then I don't maybe know that my partner is, I may not know that I'm at risk, which lessens my ability to go get tested, or lessens.
Yeah. And and I think that's the other piece. And you used the word promiscuous, and I think so many people think that I'm only at risk if I'm promiscuous, but it only takes one time for you to be exposed to anything.
A hot button.
And that I think that's part of we were talking about the social factors before.
Sure.
I think that's part of some of that stigma around that. Is, well,
I agree.
I'm not promiscuous. I'm not at risk here, and I think that also is a false thought.
Sure. You brought up the idea of the stigma of STDs. How does that play in a part of increasing these numbers or contributing to the spread of STDs, Eve?
Well, I'm not sure exactly. The issue of people having the stigma being people are ashamed because they don't want somebody to know that they have been in, have not been, especially if they've been in a very traditional relationship. It's embarrassing to think that somebody would find out that they haven't been, that they've been with someone else, whether it was a one-time thing or on a more frequent basis. There's still a lot of stigma against STDs, as you said, because people want to think that nice people don't get STDs. I mean, that's what a lot of people think, and anybody who is sexually active really could have an STD. Anybody.
Sure. Bob, what would you say?
Well, and I think that it's such a behavior-based illness.
It is.
And if I get an STD, that means I had a certain kind of behavior. And I think that's what keeps people from wanting to talk about it. And I think that in our society, I think the conversations have shifted, especially among HIV and AIDS. If you were to rewind back to the mid to late 90s, when AIDS was the #1 killer of Americans for a couple of years there in the mid 90s, it was part of our conversation. It was part of everyday life, and I don't think that it is now, because we aren't seeing as many deaths anymore. And so if folks might be thinking, well, maybe it's not as dangerous as it used to be, so I'm going to go out and I'm going to participate in risky behavior, and I'm not going to worry about reducing my harm, because I just don't hear about HIV anymore.
Sure. And you said it was behaviorally based, and often it seems like people are blamed for their STDs because it is preventable. I have laryngitis probably because I talk too much. That's behaviorally based. But is it my fault that I've got laryngitis? Is it the same thing? What would you think?
No, I'm not big on laying blame on people and putting things at people's fault. As somebody's fault, it's more of accepting responsibility for what your actions are.
Sure.
And if you accept the responsibilities for them, that includes going in and getting tested, as well as practicing safer sex at the time. And also, if you do contract something, of being sure that you are willing to inform anyone who could possibly have contracted it from you or that you've been with, so that they can also be tested, as well as any other partners they may have.
I really like what Eve said about laying blame or not laying blame on people, because it really is about the frequency of that behavior. That it often is that one time that you don't wear a seatbelt that something happens in your car, or that one time that you cross against the light, you get hit by a car. But I think with sexual behavior, it could be the same thing too. If you're participating in it frequently and putting yourself at risk frequently, obviously the chances are going to go up for you.
So it's not your fault for driving a car, but wearing a seatbelt might help in a disaster.
There you go.
It's a responsibility thing.
Right, right. Well, why would somebody go get tested? What would be the reasons? Why would I go get tested?
One reason that a lot of people go get tested is there's two things that I see a lot. Is either they're concerned they have symptoms, or they're concerned that their partner has been with someone else, or their partner's told them they were, or whatever. And the other is people who who are just entering a new relationship. Both parties would choose to be tested so that they would know that starting out, if somebody later turned up with something and they can't say, well, you must have had this and you didn't tell me. And again, laying blame, it's more of taking responsibility for being sure that you don't have anything that can be tested for.
Start that new relationship well.
Yeah.
Well, I think another time people might just realize that, okay, I had a lapse in judgment last weekend or on vacation or whatever, and that might prompt them to go and get tested. I also hear people that at a milestone birthday, okay, I'm turning 30 or I'm turning 40 and I've never been tested, and I want to give this as a gift to myself so I can honor my own health. So.
Happy anniversary.
Absolutely. Absolutely.
I like it. I like it a lot.
That's good.
So should somebody wait till they see symptoms before getting tested for an STD?
If you have reason to be concerned, I think you need to get tested right away, whether you have symptoms or not.
So what would be my reasons to be concerned?
Well, that you knew that you had been with another person, that you wanted to be sure that you hadn't contracted something, even if you didn't think they had anything, that if you had unprotected, unsafe sex with them, you might want to be sure that you didn't further expose your partners, your regular partner or partners, and you just sort of want to just find out if you're worried about it. And the other thing is, a lot of people, every year women, when they have their annual exams, will ask to have gonorrhea and chlamydia testing done because, basically they say, I don't think I have anything to worry about, but I'd rather not have to worry about it.
Sure.
And with HIV, the CDC right now says there's over 1 million people living in the United States that are HIV positive, and a quarter of them don't know.
Wow.
And so you've got 250,000 people, upwards of, going around the country, perhaps participating in unsafe behavior, and quite possibly infecting more and more people. And so it's really, it's back to that responsibility, that personal responsibility piece we talked about before.
So let's say I've decided I'm going to get tested. Kind of walk me through. You work at Jefferson County. What would it be like to be tested there?
Well, basically, we have all appointments people need appointments when they come in. We used to have walk-in clinics, but we no longer do. We have all our appointments, and the person would call up and just say what they wanted to be tested for, whether they wanted to have, the anonymous HIV testing, in which case they don't have to give their name. They come up with a number and things like this for it. And the other person is the one who just wants to make an appointment as part of another exam, or if they have symptoms. If they say they have symptoms, that, of course, becomes more of an urgent thing than somebody who's just wanting routine screening, because if somebody has symptoms, we want to treat the situation. And they then are scheduled. They're scheduled with a nurse practitioner or other person that's relevant.
Would you recommend that people come in with their partners?
I think it's always nice for partners to come in and be tested at the same time, but I also feel strongly that people need to see different people and not together for this kind of testing, because you may not feel comfortable. There may be things you don't want to discuss in front of your partner, which a lot of people think that's terribly wrong, but I'm just talking reality.
Right.
And so consequently, if I have just spoken to you and you've told me something that you would rather not share with your partner, and your partner comes in, and I know this really puts them at risk. Legally, I can't tell them that they've been exposed.
Wow.
So it's really simpler, and you're more likely to believe that it's going to be confidential and be able to comfortably feel that way if I see you and he's the nurse practitioner who sees your partner.
So there is complete confidentiality in terms of testing.
It should be. It should be.
Bob, why don't you walk us through kind of the beginnings of being tested at CAP?
Sure. At CAP, we actually have a testing clinic once a month on the last Thursday of every month. And the testing is anonymous, and it's also free. And the testing, it does not require an appointment. It's on a walk-in basis. And really the best thing, in addition to getting that test and getting the result, is the one-on-one counseling session that we're able to have with that person. Because that's really our chance to talk about those prevention messages, to talk about harm reduction, and really get into what are the behaviors that have brought you here today, and what are the behaviors that are going to help keep you healthy moving forward. So there will be that pre-test session, and then the test that we use is actually it's an oral test. It's called OraSure.
No needles.
And, no needles.
That's
absolutely.
excellent. I like that.
And it actually it takes a scrape from inside of your cheek, and 2 weeks later, your result comes back, and we actually have more than 90% of the people that come in to take a test actually come back 2 weeks later for the result, which is one of the highest clinic percentages that we've been able to find, which is we're really proud of that, and really do connect a lot of that to the candor that our employees are able to have with those folks when they're coming in. Sure. But also when you do get your results, there's another opportunity there for us to talk about those behaviors that are bringing you here, and also those behaviors that either kept you HIV negative or have brought you to the HIV positive place.
Seems like that would be really helpful. Is somebody going to get tested, being able to talk to somebody about, what has brought us here, and being able to be honest with knowing that there's going to be confidentiality. And
that one-on-one candor that I think two people can have, and that's really when, in my view, people learn the most, is when they're at their
the reachable, teachable moment.
There you go.
So do you think that's when prevention happens?
I think it's a lot of it is people have to think about it. They have to be made aware of it, and everybody's probably, a lot of people would say, oh, well, sure, everybody knows that, but people don't think about it, and not everything is planned in advance, and things happen. Yeah. People are people.
Yeah, and I think often in that moment of passion, if you will, that all of those risk factors and awareness and education often take a back seat to a lot of other things, and that's really when the frequency of those prevention messages and the repetition of, okay, this is risky, in someone's mind might help change that behavior even in that moment of passion.
Sure. What else do you think we could do for prevention, or what are your organizations doing for prevention?
Well, one is, I know we definitely we provide condoms to people when they come in. We offer them to people when they come in, and they actually, they're available. We talk about different risky behaviors. Everyone who comes in fills out a questionnaire. And it is the same no matter who you are, whether you're coming in for STD clinic, or you're coming in because you think you're pregnant, or you're coming in for an annual exam. Everybody gets asked the same question, including, are your sexual partners male, female, or both? We ask questions about, how many partners you've had in the last 3 months and 6 months, all this kind of...
Getting rid of those labels, promiscuity, or gay, or lesbian, or bisexual.
That's true.
And just going to the heart of it.
Everybody is asked the same questions, no matter what. So it's not like if you come in and you notice that, oh, that person's got that green sheet, and so have I, so that means they're here for the XYZ testing. Everybody, it's pretty neutral, and we try to be, very, very respectful of that. I think that's one of our strengths.
Excellent.
Something that we've recently introduced at CAP is actually a new outreach center for gay men on Capitol Hill. It's called The Hub, and it's at 1551 Ogden Street in Denver. And we're using that as a place where gay men can gather for groups, but also for testing, medical advice, community information, but also a place where they'd be able to learn more about those harm-reducing
in a very comfortable, safe
in a comfortable,
atmosphere.
safe place, and not a place where they have to walk through a big sign that says, STD clinic, or get your test here.
In neon lights.
Yes, in neon lights.
Well, excellent. Well, it sounds like it's actually a fairly easy process at both organizations. So I encourage everybody to go get tested, whether it's your birthday or your anniversary or you're starting a new relationship. And unfortunately, we're out of time, but I would like to thank both of you for being here, and I think it was an illuminating conversation. I feel like I'm going to go get tested right now, just in case. You never know.
Nobody's open right now.
All right, maybe not this moment, but I will soon. Okay. So thank you both, and have a great evening.
Thank you.
Thanks for asking us.
Thank you, and have a great night.
Good night.